On behalf of Atrium Innovations, I welcome you to this webinar on Fundamentals of Undernumbered Compounds, Part 2 of 2 with Dr. Dixon Tom. This is the second of a two-part educational introduction to undernumbered compounds. In this webinar, Dr. Tom will address specific organ systems as he demonstrates how the undernumbered compounds can be easily integrated in clinical practice. He will also pay specific attention to a few questions that are frequently asked in relation to this modality. Let me now introduce Dr. Tom. He is one of the founders and medical directors of the American Center for Biological Medicine and the American Center for Alternative Medicine in Scottsdale, Arizona. Dr. Tom graduated from the University of Toronto Dentistry in 1974, the Ontario College of Naturopathic Medicine in Toronto in 1986, and the National College of Naturopathic Medicine in Portland in 1989. He has been in private practice for over 40 years. His primary focus is the management of chronic disease, including autoimmune disease, neurological conditions, gastrointestinal health, and endocrine disorders. Please join me in welcoming Dr. Dixon Tom. Dr. Tom?
Thank you, Diane. Good day, everybody. So just some, paperwork aspect. I am a paid advisor to Sir Royal. However, I have no other financial interaction with the company other than to try and provide, educational information to help my patients and to help your patients. So this Part 2 webinar is going to be a little more application-based. In Part 1, we sort of went over the whole concepts of, what drainage is about, why these remedies are necessary and how important they are in our everyday practice and how they will significantly enhance your practice. So we'll do some application to give you a sense of the types of things that I've been using these remedies for now for over 20 years. So, there is a chart that is available from an electronic aspect through the electronic UNDA brochure. And what this chart is, it's probably tiny on your computer screen, but here is a list of all the 76 UNDA numbers that we mentioned in Part 1, and they're divided into different organ systems. And when I was first introduced to UNDA, I was given a piece of paper that had probably been photocopied 100 times. You could barely read it. And it was this, not in color, it was black and white, it was some pieces, some numbers, and I think it was probably in French also at the time. So it's like, and that's how I started using UNDA numbers. So when you're introduced to UNDA numbers and utilizing them, what this lays out is it lays out the idea that we have the ability to mix and match these remedies. So as I mentioned in Part 1, the remedies are divided into 4 areas. Basically, the organs, which are numbered from number 1 to number 13. The function remedies, which are basically numbered 17, to number 50, and then the elimination, number 74 to number 1002. So the ideal way, as you'll learn, through this and other future webinars, will be to combine remedies from typically the top row, the function row, and the elimination row. The row that says miasms does indeed contain important remedies, which is a whole other discussion, but for ease of starting to use, and when I'm teaching people how to use UNDA numbers and how to combine the specific remedies, I usually say for the most part, start off, pick your organ system in the top row. So for example, if you're going to treat somebody with anxiety, so we look at, there's the nervous system, which is listed under the homeostasis. So we see UNDA number 9. And then you would look down, into the function rows for the nervous system, and we see there's several remedies listed there, 41, 42, 47, and so in other words, and then we look down to the elimination of 219, 1001, et cetera. So, you know, as a starting point, you say, okay, well, I take the patient's history, I gather the information. When I know what these specific UNDA numbers are helpful for, I can pick a number 1, let's say, or excuse me, number 9. I could pick number 47, and I could pick number 219. So typically, that's the combination. We use 3 remedies. 5 drops of each remedy taken 3 times a day is the general prescription. As we suggested earlier, if it's an acute problem, then we use the 5 drops 6 times a day. So this chart becomes an invaluable way as a learning tool to help you as you get to understand and learn about the UNDA numbers themselves. So the focus of this, as I mentioned in part 1, is not to treat diseases, and I think people get hung up on it, and I have been asked thousands of times, how do you treat, and they'll list the condition, how do you treat dysmenorrhea, how do you treat PMS, how do you treat anxiety, how do you treat insomnia? And I always say, I don't treat any of those because that's really not the focus of my role as a physician. My role as a physician, and hopefully your role as a physician or therapist, is to help people understand why they have insomnia, why they have PMS. And we start looking at what are the organ system, and it's usually plural, systems, that are out of balance, that are leading this person to present to our clinics with a specific challenge for what's going on. So that said, the great thing about this, there's only 76 remedies. And since we're combining 3 remedies and we mix and match, what you basically have is the potential of about 475,000 remedies when you multiply 76 times 75 times 74, which is all the possible combinations that we have. So as a result of that, learning the 76 remedies and becoming familiar with them and getting the sense of their essence, it allows us to incorporate these into, if you do IV therapy, if you do acupuncture, if you do hands-on therapy, if you do applied kinesiology, if you do, subluxation, if you do manipulation, if you do massage, it doesn't really matter because since these remedies are not treating diseases but actually supporting organ systems, and what you're trying to do with your other therapies are support that also, we can combine these remedies into conveniently 3-week protocols. And the reason they're 3-week protocols within the numbers is because, as I mentioned earlier, when we do 5 drops 3 times a day, the UNDA number will last more or less 21 to 25 days. Now, if a person is taking the UNDA numbers and they come back, after a month, which is typically what I recommend, and they say, well, I still have half the bottle left, you know that they haven't been following through. And it's an easy way without asking, are you taking the remedies as suggested? Oh, yes, I am. Well, there's no possible way you'd have half the bottle left. So you get a sense. I mean, so compliance obviously is always an important thing. I know in your practice as it is in mine, I can spend a lot of time coming up with the perfect treatment plan, but if the patient doesn't actually do it, nothing's going to happen. So 3-week protocols. So I'll say it's 3 weeks on, 1 week off. And why do we have the week off? Because what I have found is it allows the body to sort of settle into, have we nudged that physiology? Have we nudged the biochemistry enough to maintain it? Or do we need to keep working in that particular organ system, working towards the goal of, getting all these multiple organ systems in balance? So going back to the importance, and since we talked about toxicity in part 1, it's important that we know that our main goal is how do we support the body's elimination of toxicity, which, once again, goes beyond just a physical toxin. But at the same time, we don't want to exceed the natural physiology of our organ systems that the body has. So we're going to be supporting. So we have to start somewhere. So we can't just give all of our remedies to everybody and say, well, support all the systems. So we do categorize them. And we categorize them to support the emunctories and to support these organ systems and, for all intents and purposes, and to support general health. And so I tell people what my goal is with you. You've inherited a certain amount of genetics. Your genes are your genes. And we now know with the research there's 2-3 million SNPs that have been identified. MTHFR is probably the one that most people are familiar with, which is a methylation issue and how our body metabolizes or doesn't metabolize, B6, B12, and folic acid, and we get homocysteine levels rising, which is an inflammatory marker, yada, yada, yada. So we now know that, no matter what your genes are your genes are your genes. You're going to be so tall, your skin is going to be such and such a color, you're going to be such and such a heritage. That's your genetics. However, what you have the ability to do with your clients is to teach them the epigenetic aspects of things that can be different, and that's where our support, that's where the UNDA numbers will come into play, because it'll help alter that epigenetics as you're also teaching them the lifestyle components that we talked about earlier, published in 1914 about the types of things that were common in those days are just as common in these days. So we don't use UNDA numbers individually. We use them with other modalities, drainage modalities. We can use them with the phytogens. We can use them with chemotherapies. We can use them with tissue salts. We can use them with oligo elements, et cetera, and organotherapies. So it's a mix and match, but, as a starting place, if you're new to this modality, then the recommendation is keep doing what you're doing, and let's look at the incorporation of some simple UNDA numbers into that without necessarily doing other things. So we'll talk about this general health. We'll talk about the support. We look at the hepatic system, and when you were in school and, studied this, we talk about the hepatic system and, as part of the entire digestive system. We look at the importance of the liver. And interestingly, in humans, it's the only organ where we can remove a piece of that organ and it will grow back. And in fact, you can take a liver and transplant it and slice it into 3 different pieces and transplant it into 3 different people, and it will grow eventually to the size, which is why a baby could get a liver transplant by taking a section of an adult's liver and it will grow. Or if somebody has an adenoma, let's say, in their liver, and they're able to totally resect it, in 6 months or so, the liver will have returned to its normal, which gives you a sense of the importance of this organ. I mentioned in section 1, part 1, that, the liver itself has over 300 functions. The UNDA number is 243 because, 100 years ago, they had already recognized that many functions of what the liver has. So the liver, what I think of the liver is, I think of the liver as it looks at it and it says you're either me or you're not me. So it's helping to decide, do I keep it or do I want to get rid of it? If I want to get rid of it, I need to go through, all the phase 1, phase 2, all the biochemical pathways of conjugation, et cetera, to make it so it can be eliminated either through the liquid waste through the kidney or stool waste in a solid matter. And so the biochemistry involved in that particular organ allows, that particular substance, the toxin, whatever it is, to be broken down. Oops, wrong way, sorry. Got to go the right way here. Come on. There we go. And so we get into the kidney, and, the kidney has an incredibly important function. It's not just about elimination, as you know. It also produces hormones. It makes our red blood cells by producing erythropoietin, helps us control our blood pressure. One of the things that helps us control our blood pressure. So the combination of these 2 systems plays a very important role in just general health and general wellness for people. So, we can look at this little trio of UNDA numbers along with the phytogen, the black currant, and say, wow, okay, so we have 3 UNDA numbers, UNDA 1, UNDA 20, and UNDA 243, along with black currant, which is ribes as a phytogen. And, what patient that, no matter what they're coming in for, ultimately wouldn't benefit from, I'll say, a starting point. Doesn't mean you have to start here, and especially the more familiar you are with these particular remedies, probably the less likely that will be your starting point. But for people who are new to this particular modality, new to these types of therapies, this is a fail-safe way to start supporting somebody's general health and wellness, because it has these specific remedies. Why? Because these remedies are all focused on primary emunctories, specifically the hepatic system, also the digestive system, and also the renal system. So we metabolize things, we make the liver active, and we make the liver do what it needs to do, which basically pushes things towards stool and pushes things towards the kidney, which allows people to eliminate, those particular organs. So on this slide, we see UNDA number 1. And you see that there's a formula that's listed there. Yeah, we see that there's Milliforum, Angelica, Ursi, Equisenum, Lycopodium, all in 4x potencies. Valerian is a 4x potency. The Terbinafine is a 5x, and then Argentum metallicum is a 12x. As I mentioned, the Argentum is a pure metal. The metals are in a higher potency. The herbs are organotrophic. They're organotrophic towards liver and kidney. So this is a liver and kidney remedy. So it supports both those systems, why it's so essential for general wellness and health. Now we see some of the, on the left side of the slide, we see some of the applications, and I caution and say some. This is not mutually exclusive. This is not the only reasons that you would consider using UNDA number 1 in addition to the aspects of general health and wellness. So when we have symptoms that are associated with indigestion, or people who get tired after they eat, or people who get a headache, specifically relating to foods that they're eating, or they're complaining of a heaviness, after eating, or they have heartburn, or they have belching, those types of things. Those are but a few of the indications. But as you get into more study of these, you'll see that there's an expanded utilization of the particular remedies. Now, what's important also to remember is that there's a very thankfully to the founders of the UNDA numbers, who were eclectics, who basically were herbalists. They were homeopaths. They had an understanding of anthroposophy. They had an understanding of Chinese medicine. There's a very specific way that these remedies need to be formulated. Why? Because when we have the formula, as you see it sitting there, people say, oh, that's just a combination remedy. It's not a combination remedy, and the reason it's not a combination remedy is because that UNDA 1 has a single energetic imprint. And if we were to take a Kirlian photograph of the energetic imprint of that UNDA number, it's very specific. If we were to take Angelica out or Equisenum out, it obviously would be different. But not only that, and this is truly the trade secret, and that's why UNDA has no trouble sharing you the formula, because they know that you will not be able to figure out, because of the infinite number of possibilities of how you can mix and match this many elements. So I have no idea how the remedy is put together, obviously, because I'm not part of UNDA. There is only a few people who do know, and even many of the people who work at UNDA don't know, because all they know is what their part of making an UNDA number is, which is a multiple-step process. So let's just say, for example, once again, just for example, the very first element that goes into making UNDA number 1 is Angelica and Equisenum. So the first person who's combining things takes Angelica and Equisenum and combines them energetically. It now goes to station 2, and station 2 adds the Ursi. Then it goes to station 3, and it adds the Valerian and the Argenticum. Then it goes to station 4 and adds the next, and so on and so forth. And what I was showing is when you don't combine them in the exact order as laid out by the founders, you do not end up with the energetic imprint of the remedy, which is so essential for the remedy to be effective. I mean, people will say, oh, I can graph this or graph that, but I'll guarantee you, if you were to take a picture of it, you will not see the same energetic imprint. So, understandably, you should not expect the same result if you're using it's sort of like using a knockoff of a Nike shoe. It's like, is it to perform as well as an actual Nike? You know, anything like that? The answer is no. So it's a very specific process. They're combined in a very specific way in order to make the remedy create the energetic imprint that it is that we're looking for specifically. Here we see UNDA number 20, probably the most important single remedy of all the 76 UNDA numbers. And the main reason for that is you will see that there's 4 metals in it. This is unique. This is the remedy that has 4 metals. Most of them have 1, some have 2, some have 3, but UNDA number 20 has 4. What does it tell us when we look at the remedies that are in there? It tells that it has a function on basically any and all organ systems, because the metal and the herbs have an organotrophic effect. We'll take it to whichever organ system we're trying to support. Most importantly, we tend to think of this as being a liver support remedy, as being a digestive support remedy. So we see, once again, the applications of heartburn, indigestion, nausea, et cetera, stomach pain, constipation. So the remedies, once again, is unique. UNDA 20, I can guarantee you'll never see a patient who at some point in their treatment protocol will not benefit from taking UNDA 20. It is incredibly essential and an important remedy. Just as important is UNDA 243, and you see the difference in this remedy. Remember, it's in the bottom column of that chart we showed you earlier. There's no metal. This is only plants. Lycopodium, of course, is a moss. And so we combine UNDA 1, we combine it with UNDA 20, and we combined it with UNDA 243. So if any patient has any type of a digestive issue, and, you know, from an naturopathic perspective, from alternative medicine perspective, you know, I was taught many, 40 years ago that health begins in the digestive system. Now, when you look at even other systems of medicine, if we don't have proper digestion, and now, of course, there's so much more talk about it, there's so much more understanding that what you eat does matter, surprise, surprise. What happens to it after you eat is even a bigger importance, and the importance of the microbiome, what the microbiome does with the nutrients that we take in, have a huge importance in what the manifestation that our patients are presenting with. So another thing for UNDA 243, you know, technically we call them standalones, but, you know, it's not really fair to call it a standalone. But I will say that, you know, if you're going to a Halloween party coming up, and you'll indulge in things that foods that you normally wouldn't, you know, be indulging in. It's more spicy, or, you know, it's heavier, or you know, more fatty type foods than you typically do. And so I want to take 3 remedies. Then I would suggest you carry 243 in your pocket, and every once in a while take a few drops. You'll be surprised at how supportive that is if you're you know, and normally it's not the type of thing you're going to use at home, but when you're out and about, you know, you're going to a wedding, you're going to an anniversary, you're out of your norm, we'll say. So UNDA 1, UNDA 20, UNDA 243, incredibly important remedies in this overall general wellness. And to support that is this endocrine remedy, we'll say, which is the black currant bud, which is a phytogen. It does have a significant impact on inflammation in any organ system. So therefore, it's a great combo to be added with the first 3 UNDA numbers, because it does support the respiratory system. It supports the immune system. And it is a direct support for the adrenal glands. And so somebody, you know, is trying to support stress, and how we support stress. Black currant bud is a great combination. My typical dosage is 10 drops of the phytogens twice a day. You know, sometimes you'll see 7 drops twice a day, but, you know, just through experience and using them for years and years and years, I find 10 drops a day along in complement to the UNDA numbers is a great combination to utilize. So let's look at, we're going to move away from that and look at some other general immune support as well as some GI support. it goes without saying that the digestive system, as I said, is an important piece of this, just as the immune system. As you know, we're moving into, as we move into the fall season, as we move into the winter season, people always talk about more susceptibility to colds and flus and that type of thing, and they'll say, how do we support our immune system? Well, in addition to following natural laws, there are remedies that we can utilize that will support that to just help strengthen it. And, these remedies will, which are number 3, number 20, again, surprise, surprise, and number 50, along with the phytogen Immugen, which makes sense that it's going to be a support for the immune system. We can look at these, and we're looking at general wellness. And why are we supporting general wellness at 3 and 50? Because 3 and 50 have a specific trophic effect for the digestive system. So literally for virtually any specific type of a problem that a patient may come in with any type of GI, a distress or upset, number 3, when you look at the top row of the table between 1 and 13 where it says GI, number 3 will come into play. And we see in this particular under number, we have aluminum and stannum as the 2 metals along with the individual herbs. The herbs, again, are organotrophic. They're pulling the 2 metals to the site of action, which in this case is mostly the digestive system. And so under 3, any particular problem where a patient, we see constipation, bloating, cramps, etc., any area or anything that in your history and in your examination and in your labs, etc., that you determine you believe is probably related to something below the pyloric sphincter, this would be the UNDA number that you would want to consider to support that. It's an incredibly potent remedy. It's an incredibly important remedy for children. As we know, a child's immune system, their digestive system is, at birth in their first years, is far from mature, is far from developed. And, so if we're getting colic and if we're getting atopic dermatitis where they're reacting to different types of foods because their leaky gut isn't yet sealed, because we know all babies have a leaky gut, this is a remedy that it plays a very important role in, that aspect of things. Under number 20, no more to be said about that. As I said, the important thing to look at that is the fact that it has 4 metals. Incredibly, when you have metals add to the profoundness of the remedy and the profound effect that it will have for healing. Under 50, once again, has 2 metals in it, along with the herbs, and it's pretty much like under 3, can be utilized and is anything from the small intestine through the large colon. So whether you are looking at small intestinal bacterial overgrowth or just some malabsorption, digestive problems, pancreas problems, problems within the colon itself, whether it's looser stool or constipation, or you get cramping or irritable bowel, or anything. I mean, the laundry list is very long for the utilization of this particular remedy. So under 3 and under 50, virtually any type of gastrointestinal issue, especially for problems below the pyloric sphincter. Just as a note, it's not on the slide, but if you have something above the pyloric sphincter, then the UNDA number that you would consider is UNDA number 4, not number 3. So above the pyloric sphincter, from the mouth to the stomach, is 4, so it's heartburn and esophagitis and reflux, etc. And then below is UNDA number 3. Going along with, and so we talk about, health begins in the gastrointestinal system. If you don't have a healthy digestive system, your susceptibility to infections, to flus, to colds, to those types of things will be, unfortunately, muted, because, as we know, 60, 70, 80% of our immune function literally occurs within the whole digestive system through Peyer's patches, through the organs that we basically showed. And now we have a phytogen that basically has sea buckthorn, walnut, and dog rose, which are all supportive of immune function. And one of the very fascinating things about sea buckthorn is if you were to look at where the plant grows, it's almost this isolated plant, because what it does is it eats everything. And so nothing else survives. So it eats a virus, it'll eat a parasite, it'll eat a bacteria, it'll eat a fungus. So it's an amazing, all-encompassing immune support remedy. And people say, well, what's the best remedy if it's bacteria? What's the best? This is the best remedy, Imugen, because of the fact of the sea buckthorn. We know walnut has been used historically for any type of gastrointestinal distress. We think of it with the omega-3, but we also think of it with parasites, or some type of a dysbiosis that occurs within the gut, which can be affecting our immune health. And then that dog rose has a specific aspect of, either from allergy perspective, so from an EENT areas, from, the collarbone up, it can be a factor. So if you're looking, for your children, your grandchildren, or yourself, to what can I do to support, myself through the fall season, through the winter season, before you get into the other seasons of the year. The 3, the 20, the 50, and Imugen are great general wellness, general health, immune support, and in addition to that, for patients who have specific issues, it serves as even a more important, series of remedies. If we look at emotional wellness, if we look at our nervous system, with the nervous system, of course, is our master computer. It's our hard drive, if you like. We talk about this, and now we know that, we call it the brain-gut connection, and that, even in conventional circles of psychiatry or psychology, we'll say, this particular remedy is, this particular system, is the guide or the protector for everything. And at the bottom of that slide, we see the sympathetic and the parasympathetic divisions of the autonomic nervous system. And so, ideally, in an ideal day, what we have is when we're awake and alert and you're listening to this webinar, the sympathetic nervous system will be taking place because of what we call it the flight-fright aspect of our nervous system. And then the parasympathetic nervous system, as you well know, is about rest and relax and heal and recover. And so 60% of the day, ideally, the nervous system is in the sympathetic mode, which is the awake mode. And 40% of the day, it's in a more parasympathetic state, which ideally is our 7.5 to 8.5 hours of sleeping, plus our 3 meal times, where we're sitting in a relaxed place, we're calm, we're getting all the necessary nutrition to be able to digest things. But what we see in our patient population, especially if you do some specialized testing like heart rate variability, which are now done on Apple Watches and all kinds of devices which allow us to be able to do that thing now, we see that people are very seldom in that 60-40 balance. In fact, many of our patient populations are going to be 100% sympathetic, or if they've been in this journey for a while, they'll be 100% parasympathetic, where they've sort of gone over the hill, and the body is saying, oh my God, we're in such a state of imbalance that we better put the brakes on because we're going to crash this car that we're driving, to create a balance. So we spend a lot of our time in drainage trying to balance these multiple systems, be it the central nervous system or be it the peripheral nervous system. And we see, of course, a whole list of different challenges within our nervous system coming from different reasons, and we'll do our best to support them on a physical level if that's necessary. So the 3 of the important remedies to support and the phytogen are UNDA 9, UNDA 30, and UNDA 1001, with CalmGen being the, as the name suggests, calming of the nervous system. UNDA 9, like UNDA 20, at least in my practice, is probably the second most common remedy that I personally prescribe. I would say why my patient population and perhaps your patient population, and almost seems rare nowadays, that I would say at least 75% of patients come in and they're either talking anxiety, panic attacks, depression, and combine that all together, and they may not say those words, but then they'll say they're fatigued. So then you'll say, well, your thyroid seems okay, and the adrenal seems okay, and this seems okay, and you're not anemic, you're not losing blood. Why are you tired? And it's an emotional fatigue. It's a mental fatigue. That is probably predominates over the physical reasons, in my practice anyway, where people will find that they're actually tired. So this remedy, which contains two of the deepest metals, aurum, which is gold, and plumbum, which is lead, very deep acting into the nervous system, and you see the applications of fatigue, headache, anxiety, nervousness, et cetera, et cetera. So you'll be hard-pressed in very few patients to not need UNDA number 9 at this point in time. And then number 30, which contains lead also, is I tend to think of, you know, sort of this heightened anxiety, people who have insomnia, insomnia from the aspect that they can't fall asleep, and people say, well, if you can't fall asleep, why can't you fall asleep? And are you hyped up, which probably means you're in sympathetic dominance. Maybe it's your endocrine system that's done that through adrenal because you exercise at 8 o'clock at night, and maybe you should be exercising in the morning and not in the evening. Or you're watching some television show that gets you all hyped up, or you talked on the phone to somebody, or you're still doing business, or you're still sitting on your computer, which you shouldn't be doing into the evening. You know, something is revving up your system. So UNDA 30 has the ability to just generally calm things down, and 9 and 30 has a very calming effect, and we see valerian as one of our herbal remedies that are in there. And specifically combining it with UNDA 1001. So if somebody has any type of problems falling asleep, problems staying asleep, or they wake up, they're ruminating, they have bad dreams, they have nightmares, and whether it's a child or an adult, you know, something is upsetting their nervous system, particularly as their nervous system should be quieting down, but they can't really quiet it down. This is a great combination of remedies that ultimately can support that. And then again, of course, the phytogen, which goes along with that, is CalmGen, which has silver linden, the ficus, and hawthorn, as an interesting combination of herbal remedies to support just the calming of this nervous system. And just like the combination of 120 and 243 for just general health and wellness, I'll say for general health and wellness of the nervous system, this particular combination won't be 100% of your patients likely, because not everybody is having those challenges, but a high percentage of your patients would benefit from just that combination, because as we know, if you don't sleep well, you'll have a very difficult time healing, and healing only occurs during the nighttime hours. So, you know, that's when we need to be in this relaxed, calm state and pleasant dreams and getting into REM sleep, et cetera, for what's going on. Importantly, as another among three, of course, is our urinary system and our renal system, which of course has these particular functions of, we always think of just, you know, getting rid of urine, but there's a lot of things that happen before that the bladder gets filled with urine to be eliminated from the body. So we have the renal system, and so we have remedies that support this. We have UNDA number 2, UNDA number 7, and UNDA number 44, along with the phytogen, the heather young shoot. And, you know, right, if you, urinary tract infection, you know, people say, oh, do you need an antibiotic? So if somebody, you know, through your history diagnosis and doing a urinalysis, the person has a urinary tract infection, there's your prescription. That will, in 1 or 2 doses, they will notice an improvement. And in fact, you know, and so it's an acute remedy. Remember, acute, 5 drops 6 times a day. Before an antibiotic could even have an impact, these UNDA numbers and heather will basically have pretty much eliminated their system. So maybe stop the remedies? No, remember, you have to go 2 days past the cessation of all symptoms. So we will continue at 5 drops 6 times a day for 3-4 days, or at least, per se. Maybe it'll be a week. It'll depend on the patient, but this is an incredible combination, not only for acute urinary tract infections, but any type of issues involving the renal and the urinary system. We have argentum in there, and when I mentioned the metals in part 1, I said these are for immune type things. So we see there's and the great thing about UNDA number 2, UNDA number 2 is the elimination. It will support all 5 among trees, not just the kidney. It's the one remedy that has sort of as a very broad brush. And so even if you, for whatever reason, you weren't going to use UNDA 3, you can use UNDA 2. In fact, you can use UNDA 2 with every organ system, even though, it says most applicable to the urinary system, which is true, but you can use it for the nervous system, you can use it for the respiratory system, and in fact, in acute prescribing, UNDA number 2 is always one of the remedies because it will support primary and secondary ebunctories, which is a very important aspect of things. UNDA number 7, which again has argentamin as an infection remedy, is urinary tract, supports urinary health. And so this is your typical cystitis, I'll say, or in a man, prostatitis for that matter, or incontinence. So anything related in that sphere of things organ-wise, UNDA number 7 would be applicable. UNDA 44 is a urinary organ system. Aurum and argentum is the 2 metals that are in this one. And so this one can also be used and is used in sort of acute things, also be used for chronic things. But this is a great eliminator if for things of any type of a toxin that will get out through the liver, through the kidney. The liver will break it down, it'll put it into an aqueous form so it can be eliminated as a liquid. This is the remedy. Patients who have a very challenging interstitial cystitis, which doesn't really show that there's an infection there, people who have mercury toxicity or lead toxicity. It's a really important remedy to support that particular organ system to be able to get things to eliminate from their system. And then traditionally, the one herb that's in there is heather. And heather, we know, has been used because it contains the tannins and the flavonoids, such as quercetin, which is as an antioxidant, will have a very potent effect and has a very potent effect specifically to the urinary tract. So urinary health, heather would be the type of thing you would have on hand, particularly if most of your practice deals with women's health or just women in general who get a urinary tract infection. But it's a great thing to have on the shelf for a patient in their emergency kit, because if the first signs that they're having an acute problem, they start taking those remedies, for the most part, it's going to do the trick, for what it needs to do. So we've talked about, general health and wellness with 120 and 243. We've talked about some digestive health and general wellness in there also with 320 and 50, and of course we have the corresponding phytogens that go with it. Nervous system aspects with 9, 30, and 1001, which many of your patient population will benefit from unless you have a very unique group who don't get anxious or who don't have sleep issues or don't get uptight, and then anything related to the urinary tract with, in the number 2 and the number 7, 44, and heather. So that's a bit of an overview of the types of things of how we mix and match. Of course, there's thousands of combinations. I said there's something like 475,000 combinations that are possible. So having taught about these remedies for upwards of 2 decades, I get questions all the time. Why would I add another modality into my practice? When I was first introduced to these, of course, I had zero experience with it, as many of you listening to the webinar today will have zero experience with it. And what I can tell you from a clinical perspective, this makes your life so much easier. Why? Because it's dealing with physiology, because it's not treating diseases, anything that you're presently doing that you've had success with, that in your own experience has been helpful, when you enhance the body's own physiology, and we're not going against physiology, we're working with the physiology, it makes it so much easier. And as a result of that, patients respond much more quickly. They respond in a way that many times they are even surprised that after years, in some cases, of being treated by, a whole variety of different types of therapies, they haven't really responded in a positive way. So the UNDA numbers, as a result of that, make the incorporation into your clinical practice and your life so much easier. Are there situations in which the use of UNDA numbers might be contraindicated? Until you are familiar with the remedies, I would say possibly. And anyone who's studied the UNDA numbers and who understands the essence of the UNDA numbers, as I like to think that I have a pretty good understanding of that, the answer is, in my practice, is no. There isn't any patient that I would, no matter what they would come in with, that I would ever hesitate giving UNDA numbers. The thing that does change, however, is not the UNDA numbers, is the dosage. I have some patients, in fact, one right now, I've had many, but one patient this week, basically, that is hypersensitive. And, to the point that even one drop will cause her to exceed her physiologic limits. So then we have to dilute it, put in a little bit of water. We take one drop of that, or we put in a little bit of water. So other than those patients who are in a hypersensitive state, and you have them, we'll call them people with chemical sensitivities. We know it's their liver. We know their liver is overburdened. We know their liver is overtaxed as a result of that. So remember what we're trying to do with the UNDA numbers. The UNDA numbers are not treating a disease. They're supporting physiology. If you exceed the physiologic limits, it's like stretching an elastic. If you stretch the elastic too often, too long, it doesn't come back. So if you stretch the physiology beyond the physiologic limits of the cell, people say, well, I reacted to it. I got a headache. I got a skin rash. I had a temperature. I had a fever, whatever. And they think, oh, I'm reacting to the UNDA numbers. Actually, you're not reacting to the UNDA numbers. What you're reacting to is the physiologic effect that the UNDA numbers are creating. And so we need to slow it down, and we need to slow the dosage down. So technically, the answer is no, but in specific situations, you may have to be a little more cautious, generally speaking. Common question is, how long do patients generally use UNDA numbered compounds for? Depends on the reason that they're coming in. If it's acute, they'll use them for less than a week. If it's a chronic problem, if somebody has an autoimmune disease, a gentleman a few weeks ago came in, he's 66. He started having rheumatoid arthritis symptoms in his teens. So he's basically had almost 50 years of a degenerative autoimmune process. So in all honesty, he'll use UNDA numbers the rest of his life, because you can't just unravel UNDA numbers in 2 or 3 months and say, okay, we've peeled off, years and years and years and years and years of the onion and say, okay, we're done now. Now, does it mean every single month that they do that? No, because I do a lot of mixing and matching in the cases that I treat. And so is it common for the first year every month? Yeah, I would say so. Maybe even 18 months. Yeah, 18 different prescriptions. Yeah, that's pretty common. Once again, it's my patient population. I'm not dealing with acute things. I'm dealing with chronically ill people who've had these problems for many, many years, many times with many other physicians. Many times I may spend a year just trying to sort out, what some of the other therapies have tried to support the patient with. So the timing is, when do we know we don't need them? When the organ systems are basically imbalanced and the physiology is telling us that we're in a pretty good state of homeostasis. That does not mean you never get sick. You're supposed to get sick. In fact, if you're not getting sick once a year, you're not tuning up your immune system. So, from that aspect. This session obviously focused on the fundamentals of try to give you a bit of an idea of what you could look forward to, of how to use some of the protocols, how you could, even without taking some of the additional courses and classes and webinars that will be offered, you could use it in general health and wellness. You have an acute urinary tract, you have the 3 remedies, you have the phytogen. If you start using that, you'll be surprised how quickly these remedies can learn. So on an annual basis, I've been teaching a complimentary 7-series on UNDA numbers. So you could look forward to that, moving forward to where we address much more specifically. We go over specific type cases. We go over all 76 UNDA numbers in more detail, so you get an idea of the essence of the remedies. And of course, the incorporation of these, it isn't something you take the 7 series, over 7 different weeks of 2-hour sessions of webinar, say, okay, I'm an expert in this. No, you have to start incorporating these. I mean, I used them the numbers and did, prescription after prescription after prescription. And in the years I've been doing it, I calculated one day I've given or recommended over 100,000 different combinations of UNDA numbers. So a pretty good idea of what to expect when I do them. It took me years and years and years of doing that to become incredibly proficient. But you're going to be proficient the very first time. The very first time you learn any modality, you don't say, oh, I'm proficient in it now. I practice it. The more you practice it, so even from this basic introduction, I would highly encourage you to do the 3 or 4 little systems that we just talked about. Give it a try. Try it on yourself. You want some general wellness? Try 120 and 243. See how it makes you feel. And then give it to, a good friend or one of your patients that you're having some challenges with, or a patient who's doing really well who will give you really honest feedback. That's what I did. I was always asking my patients, tell me how you feel. Give me some honest feedback. And that's how I learned to become so familiar with the remedies and how I learned to have such an incredible positive trust in these remedies. That said, that gives you hopefully a bit of an oversight, a bit of an overview of what the potential is, and I would hope that in the future you'll be interested in the 7 series, UNDA series that I teach, and learn more insight into this. But even before that comes up, it would be time to give it a try, and you'll start to get a feel for these remedies, and you won't be disappointed. That I can guarantee you. And hope you enjoyed that. And another thing I may encourage, and as I was taught by Dr. Guinaud, my mentor years ago, he said you need to hear something 7 times to really start to understand all that was it. So I realize you've listened the last 45, 50 minutes to this, but try and take another opportunity to listen again. You'll hear something different, and then start incorporating it. And you'll be very pleasantly surprised how much it has a very positive effect on your practice. Thanks for your time.
Thank you, Dr. Tom, for an excellent webinar, and thank you also for your participation. Now, Dr. Tom has just provided the basics on how the UNDA-numbered compounds can be integrated in practice, and he also addressed a few very rudimentary questions on this topic. Now, each year we offer an in-depth 7-part webinar series that takes you through a comprehensive training on this modality. If you're interested in elevating your knowledge in this area, please reach out to your Atrium Innovations representative to facilitate this. If you have any additional questions, please contact your Atrium Innovations representative. And if you do not have an account with us and wish to do so or require additional information, your representative can be contacted at 1-800-263-5861 in Canada or 1-888-737-6925 in the U.S. Thank you once again, and enjoy the rest of your day.